I'm Lisa Ling, and this is The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. We started this series 9 months ago in the early days of the pandemic to create a forum for scientific truth during this crisis. Turns out that the need for clear, accurate, science-based communication about COVID-19 has never been more important in what is possibly one of the greatest public health crises of our lives. We've had millions of eyes watching on LinkedIn, Twitter, Facebook, and YouTube with viewers from Europe to Brazil to New Zealand. And as the road continues, we want to continue talking about this from a global perspective and to keep giving you a chance to get your questions answered in real time on this show. Now, this is our final episode of the season, but we have saved the best for last. Today, our incredible lineup includes a discussion with Dr. CHEN former Vice President of Taiwan, about how his country curbed COVID. Then we'll visit Penn and Ann Lee, co-founders of Core Response at their Los Angeles testing site, to talk about how their organization has managed to administer free testing in cities across the country. And finally, J&J's Dr. Paul STOFFELS will be here live to answer your questions and give his thoughts on where we go from here. But first, as always, let's look at the numbers. As of today, there are over 63 million confirmed cases worldwide, over 1.4 million global deaths, and over 260,000 deaths here in the United States. The US has the most cases at over 13 million. India has 9.4 million, and Brazil has 6.3 million. In the US, millions traveled home for the Thanksgiving holiday, and Dr. Fauci has warned of a surge upon surge of cases in the next few weeks. The governor of my state, California, has announced that hospitals could be overloaded by the middle of December, and a full stay-at-home order could be in our future. Now, in an acknowledgement of the importance of nurses in fighting this pandemic, the Biden administration announced that Seattle nurse Jane Hopkins has been added to its already impressive COVID-19 advisory board. Europe is showing small signs that current lockdown restrictions are making a difference, with daily confirmed cases falling in some areas in the last 2 weeks. There's also been a lot of news on the vaccine front. Johnson & Johnson has started its global phase 3 COVID-19 vaccine trials, and we'll talk to Dr. Paul STOFFELS for more on that later. Now for our first guest. He is someone that I've been trying to get on our show for months. As Vice President of Taiwan, he led his country's incredibly successful battle against COVID. A densely populated country of 23 million people, Taiwan has had just 7 deaths to date. And not only did the country not shut down its economy, it has reported positive economic growth this year, despite a global pandemic. Now, Taiwan was hit hard by a SARS outbreak in 2003. So when COVID hit, it put a national plan in place immediately. You could say in some ways they've been planning for this for 17 years. A couple of days ago, while quarantining in my bedroom after exposure, I talked to Dr. CHEN Chen, former Vice President of Taiwan, who also happens to be an epidemiologist, about his country's response and how it might be an example for the rest of the world. Vice President Chen, thank you so much for taking the time to be with us. I have been so looking forward to talking to you because Taiwan has had such success in managing COVID-19, and you have played a key role in it. You are an epidemiologist by training and uniquely suited to take on this crisis. How did your background inform the national plan?
Well, that's I was a very unfortunate guy because I was appointed as the health minister in year 2003 at the peak of this SARS outbreak. So I learned how to contain this outbreak. And also after the SARS outbreak, I did do the reform of our pandemic containment system. So in January 22nd of this year, our president, Dr. Tsai Ing-wen, she held this National Security Council meeting, and she asked me that, okay, CJ, you have to tell us what have you been doing during this SARS outbreak. And then I say, well, we have to do something. And then, have you do any kind of transformation of the pandemic system? I say, yes. And she also asked, okay, what kind of new technology you consider it would be helpful for the containment of COVID-19? And I told her that at that time, it's very difficult for us to get this face mask. And she said, okay, then Minister of Economic Affairs has to push that. So we quickly solved the problem of the shortage of face mask. And then she said, okay, and any other things we have to do? I said, yes. Nowadays, everybody have the mobile phone, and then we can use this ICT and AI technology to help us to do this containment of COVID-19. And for instance, at the airport, we use this app. There's an entry app, and people can answer all this health status questionnaire, and they're traveling, and also there's a contact and clustering or occupation history, and they can pass this custom quite quickly. And then they get a message from their mobile phone. They have to be isolated at home for 14 days. And then when they arrive at home, we also send a specific taxi to send them home, not use the public transportation to avoid the transmission of the virus. When they arrive at home, then their mobile phone will send them what kind of regulation they have to follow. And every day they have to report the health status, their temperatures, and also their needs. And they don't need to write down anything. We have face recognition and use natural language processing, so they can input the data, just speak to this on a mobile phone. So we use this kind of ICT technology a lot to warn people to take care of themselves, to have a very good self-health management.
You mentioned that you're having positive economic growth. And you also talk about how you provided stimulus right away. Can you briefly describe how that worked?
Okay, yeah, there's majorly that's three policies. The first one is for severely affected industries such as the traveling, hotels, vendors, and restaurants, and tourism, and so forth. And for this industry, the government will support them financially and to keep their employer still working in this industry. So that's to avoid this unemployment rate a lot. And for the poor family who might lose their job, and then for them, we also provide the subsidies for these low-income families. And this, we call this financial relief. And for the economic stimulus, every citizen in Taiwan, including the young baby, they can get 2,000 NT dollars to buy daily supplies and so forth. But they have to chip in another $1,000 in order to get this $2,000. In this way, people, if they receive the money, they have to spend it out, not put in the pocket. And in this way, we can stimulate this our domestic consumption. And so I think it's very important. If you want to give the people money, you have to ask them to spend the money, not put it into your pocket. And that's the way we try to stimulate this the economy using these so-called matching budget to do that.
Yeah, it's incredible to me how you've been able to have positive economic growth, didn't have to lock down any cities. You just had a certain number of people quarantined, and they strictly adhered to it. You did mention that there was a penalty for anyone who did not follow the guidelines. What would that penalty be?
Okay, basically in order to enforce this home isolation and home quarantine, we use both stick and carrots. For carrots, if people need some help or some support, we provide support and care services. And for instance, we deliver food, grocery, to their home and help this garbage disposals. And if they have any kind of symptom and sign, we send an ambulance to take them to the hospitals for care. If they did not follow the rule, the highest penalty is 2 million NT dollars. That's quite a huge money. But fortunately, that's the range is from this 100,000 to 2 million NT dollars. And among this 380,000 people, around 1,000 people got a penalty. And most of them are so-called minor penalty rather than the major one.
It's incredible, Vice President Chen. I mean, the public has to be so compliant with the guidelines, right? Wearing masks and in some ways, you know, having to sacrifice some privacy issues, right? If you are so rigid about the contact tracing. So how compliant would you say the population has been? Have you had any kind of adverse reaction to the things that you've implemented?
Okay, yeah. If you want to avoid this kind of complaint, and then to enforce this compliance, I think the one thing that is important that you have to get the public trust. It is definitely very important in a vibrant democracy like Taiwan, and our Center for Epidemic Control. Basically, they have daily press briefing, and they announced the current status of the outbreak and the government regulation, and the reason why we want to do home isolation, and reason why people have to wash their hands with soap frequently and put on face mask and have a limited visit of the hospital and so forth. And through this kind of transparency, and also that every people have this access of this information, I think that our CCC get public trust quickly and get their support. I think this transparency is definitely very important. Don't try to hide anything, and the people can trust you. And once there's public trust, then they will comply to this government regulation, and this outbreak contained much better than other countries, and they say, oh, CCC is doing good, and then come back to support it. So it becomes a virtuous cycle. And another reason for people have better compliance to it is we did suffer a lot in year 2003 when there's a SARS outbreak, and people know that good personal hygiene is important, keep distance, social distance is important.
Even though you haven't had any positive cases of COVID for a couple hundred days.
That's right, 200 days.
Yeah, over 200 days. Are people still wearing masks when they're around people, when they're out in public?
Yes, we encourage people to wear face mask. According to a report from New England Journal of Medicine, the experiments tell us that wearing face mask is definitely very important. Interestingly, you can see that in this last 10 months, there's a lot of infectious diseases, including this seasonal influenza and this enterovirus infection, all declined. We are not trying to prevent that, but it seems to be useful. And I think it's very useful. So people here used to wear face masks. I know that in the United States, in European countries, people are reluctant to do it, but it is very useful one. And I encourage everyone to use it if you are going to keep contact with someone at a short distance.
My last question, Vice President Chen, is are there any plans to open Taiwan soon? I understand foreign travelers still can't come into the country. How long can you keep the country closed? Okay,
basically, for the time being, we don't allow the people to come to Taiwan for tourism, basically. But for the migrant workers, for less business people, and for people who have urgency, home, family gathering or something, we allow them to come back. And all Taiwanese citizens are free to come and go, and they have to, of course, they have to subject to 14 days home quarantine for the tourists, I think that it may be implemented until there's a vaccine is available. If the vaccine is available, I think there's an after 2 shots, 2 dose immunization and pass for 14 days, people are allowed. May be allowed to get into Taiwan.
You know, let me just ask you really quickly, what is the country's plan to distribute a vaccine when it becomes available?
Yeah, we have 2 ways to get a vaccine. The first way is to purchase any vaccine that's already passed this FDA approval. And another one is to encourage our vaccine industry to produce vaccine here. And we have 3 companies that are already get into the clinical trial phase 1 and is going to finish. And I think that they are going to get into there's a phase 2 clinical trial in December. So we hope that the local vaccine will be available in the middle of 2021.
Well, Vice President Chen, thank you so much for taking the time. I know that you have so much on your plate. You've been so busy, but we really appreciate it. And I laud you on the incredible success that you all have experienced in combating COVID, and you really are a national treasure for Taiwan. Really, thank you.
Thank you very much, and this is my pleasure to be interviewed.
Just for a little conversion help, Dr. Chen mentioned that every citizen of Taiwan was given 2,000 NT dollars in the beginning of the pandemic that they had to spend so that it would go back into the economy. That's about $70 every day, and I believe that's still continuing. Just incredible to me how the Taiwanese government jumped into action to battle COVID with such a robust national plan with transparency and trust. That was former Vice President of Taiwan, Dr. Chen Chien-jen, from whom we all can learn so much. Now, in case you're just joining us, this is The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. We are coming to you live, and coming up later in the show, we'll have J&J's Chief Scientific Officer, Dr. Paul Stoffels. We'll be here to answer your questions and give us an update on the status of J&J's vaccine candidate. We invite you to put your questions in the comment section, and we will try to get them answered, as many as we can. Also coming up, we'll talk to actor and activist Sean Penn about how his organization is fighting the COVID-19 pandemic 1 test at a time. But first, we are so grateful to our frontline healthcare workers, and we want to give voice to their experiences. Here is a radiologist in Australia who experienced COVID-19 firsthand.
On the 18th of July this year, I tested positive and went into 2 weeks of mandatory isolation. We were by far the most affected state. The lack of full face shields, in my case, I think seriously contributed to my acquiring COVID. What followed from there was probably the most debilitating and scary journey of my life.
As a close contact with my father, I wound up getting COVID. It was just utterly physically debilitating and exhausting going through that.
Sitting around the dinner table and sharing our experiences, as limited as they were, became the way that we bonded and how we maintained sanity. The harsh lockdown conditions here in Victoria have resulted in us having 24 days now of 0 infections and 0 deaths. The mandatory wearing of masks, the restriction on travel, the closing of restaurants, pubs, bars enabled us to open up now and to start to get back to a more normal version of life here in Victoria.
Thank you so much to Bruno and Isaac for sharing your story. You are watching The Road to a Vaccine, a series exploring the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. Now, previously, we had Ann Lee, co-founder of Core Response, on the show, and I was so impressed with the incredible work she and actor co-founder Sean Penn are doing that I wanted to visit their site, but I wasn't able to because, again, I was in quarantine in Los Angeles. But I paid a virtual visit to their massive testing site here to find out more about their game-changing efforts. Sean, welcome to the show and welcome back. Sean, we talked to Ann previously about CORE and your crisis response. What would you say drove you to pivot CORE to conduct COVID testing throughout the country? And would you say that testing is crisis response as it relates to COVID?
Well, what drove it is just having the infrastructure of a disaster response organization. We agreed we should, raise our hand and volunteer in whatever way we could. And then it was the guidance of Governor Newsom in California here who led us to the Los Angeles Mayor Garcetti and the Los Angeles Fire Department, who had already stood some test sites. But those sites were having to be manned by Los Angeles City firefighters, which took them away from their other significant duties. So we were able to systematically absorb those sites and get the firefighters back on the streets, and then continue to evolve the sites and expand the sites. And then ultimately that led to continuance throughout the country.
And when we last spoke, you were at your testing site at Dodger Stadium, and cases had come down quite a lot. In fact, you said that people weren't really testing as much as they had in prior months. What is the status of testing now? And has the positivity rate been increasing of late? And I'm just curious, would you say most people who are testing positive are asymptomatic?
So we are seeing a huge spike in the number of people wanting to get tested. Since Mayor Garcetti announced that our Dodger site is open from 8 a.m. to 8 p.m., we've seen almost a doubling of the number of folk coming to get tested. So we went from an average of about, I would say, 4,000 to 5,000 people just in Dodger Stadium to about 8 to 9. So in total in Los Angeles, we're seeing about 20 to 25,000 people per day. Again, this is an increase, I think, from the amount of positives that have increased during the spike, and we are seeing a larger number of positives are coming through. In terms of asymptomatics versus symptomatics, we aren't seeing the folks that are coming through enough. We don't have enough time with them to sort of make that determination, so we don't know.
And Sean, you all started testing very early on in the pandemic. What were those early days like in Los Angeles when testing wasn't as widespread? And now that we're over 8 months into this pandemic, are we where we need to be in terms of testing?
Yeah, well, the early days, it was very, circling back to your previous question in terms of, is testing disaster response? It's a component of disaster response, because we know that, and we've been talking about this from the early days, that the contact tracing, the quarantining and the isolation, all of these wraparound is what creates a true and complete disaster response in a pandemic. So this is a significant part of it. The early days were so much learning as you go. That was true from the scientific community through the fire department to us, and constantly refreshing and taking lessons learned and building on it. It was actually quite surprising to me at first, the number of people that were starting to come in, and of course then it built as we needed to spread, and then it got very difficult in the summer months where you're doing outdoor sites, many of them in static sites where on tarmacs, very hot. You have frontline workers working in PPE all day, and all of those problems to solve and so on. Where we are now, one of the things that CORE has done is increasingly move to the mobile site option, which allows us to get to the marginalized communities that are the ones that have the most difficult time getting tests. The one thing also that I'd like to say, because even in the car riding into this Crenshaw site today, there's still not very clear-minded reporting about the tests and the efficacy of these tests. There's so many types of tests out there. These are the PCR tests. This has a 24-hour turnaround. We do the contact tracing immediately, everything within a 5-day period to happen. It has very high efficacy to get you, not a question of whether or not you have had COVID and you have the antibodies. The tests that we do are specifically to give the highest efficacy answer, are you positive or negative?
And in the past few weeks, we've just seen this dramatic increase in new cases all over the country. Yet I understand these numbers might actually still be an underestimate of how many people in this country are actually infected. How many people do you think you all have tested to date?
Right now, we've tested 2.5 million people across the United States, and just in Los Angeles, around the 2 million mark. And for us, you know, we're quite proud of this number, but at the same time, it's not enough. And it's shocking that we are still the only organization that is testing at this scale. It should be a source of pride, but it's actually a source of shame as a country in terms of where we are with the testing. With this increased number and spike, with what we're expecting to see also in the future, it's not enough, and it needs to increase significantly.
What you all are doing out there is incredible, given how many people have been tested by CORE throughout this country. It seems like you have a lot of volunteers out there working with you, which really demonstrates how Americans are stepping up during this difficult time. Sean, how is your service funded? And can you talk about key partnerships that are helping you do this work?
So our organization is pretty much a beg, borrow, and scratch. Fundraising from formal fundraisers that we do to reaching out to small donors throughout the country and the world. And so when we jumped into COVID, we jumped into an extremely expensive process, because part of what we do is also offering jobs where we have so much unemployment. Throughout the country, our sites are filled with staff who we've trained and who we pay. And so to do it that way, one, we have a great partnership, Anne can speak more to it, with the Curative Lab here in Los Angeles, and that we use in some other regions as well. But then what happened is, after initially partnering with the city of Los Angeles, we got an incredible donation from the Start Small Foundation, which is Jack Dorsey's. Initially, it was a $1 billion fund for COVID worldwide, and that now in the stock prices with Square, his company Square, is valued, I think, at about $3 billion, that fund. So he gave us an initial $10 million, and then complemented further with another $20 million. From that, we've been able to leverage $15 million. Now that seems like a lot of money, but I can tell you that this kind of work, because emergency work, it goes very fast, and so we are always looking for more help. But Anne can speak to that better than I.
Across the U.S., we have a number of great partnerships with our counties and with the cities. Fulton County has been phenomenal, Cobb and Gwinnett, sort of the larger greater Atlanta area. But I think it's been such an incredible mix of private sector, government, as well as the nonprofit sector.
Not to be undervalued are the partnerships with other organizations, so that we're not having to overlap and double up on our resources. So for example, Jose Andres' World Central Kitchen has been an extraordinary partner for us in a lot of our areas of operations.
On that note, Sean, I think we've all been hoping that the pandemic wouldn't last past 2020, but it's obviously not showing any signs of abating, and experts are warning that in the winter months it's going to even get worse. So will you all continue to offer testing through CORE in the new year, and what are your hopes right now for how your service might evolve for the growing needs?
We're going to offer our services until this thing is completely disarmed, whether we'll wait and see whether the infrastructures are available for us to turn sites like this into vaccination sites. We're already in some cases doing flu shots along with the COVID testing. It didn't need to last this long, and that's really a question now. You know, so many people are in so much pain and loss, be it directly from COVID or from the economic hardships and so on, or just the lack of a hug from a loved one.
Well, given that we haven't had a national plan to battle COVID, we are going to have new leadership at the federal level that will take over in January. So do you think that things will change much in the way we are handling this pandemic as a country?
We have tremendous hope for the way in which this new administration coming in January will focus its attention and resources, and also give a new sense of leadership that is not divisive. I think that as success is shown by adopting these new protocols that will come down the pike, more and more people will get in line, because it isn't just a question of keeping the fuel in their rage. It's also a question of being able to pay their rent and to have access to health care. And these things are, I think, equalizers that will point us in a far better direction.
Given that experts the world over have talked about how essential testing is in ever, getting to combat COVID, what would you tell the incoming administration where we are? Like, what would you say to them in terms of what we need to do to make widespread testing more accessible to all people?
Well, I think multiplying the model that Cora has developed is one significant thing on the testing component of this, in the sense that you're looking at private-public partnerships between, whether it's local governance or from the federal standpoint. We have found ourselves on the front, with a front row seat to the development of these programs. And so I suppose what I would say to this incoming administration is, we got our hand up if you need any help.
Anne, would you like to add to that?
Sure. Early on, as Sean was saying before, we're a constantly iterative organization. We realized, and he pushed us very hard, that testing is not the answer by itself. It has to be connected to the tracing and the resource coordination piece to it. I do not know of any non-governmental agency that is doing that full stream of services as we're providing in Fulton County and in the larger Atlanta area. Again, we're doing this as well in Navajo Nation, where we have seen the direct benefit of this approach to decrease and to flatten that curve significantly. So we have a model, and to be able to replicate that across the United States has to happen now, and should have happened, months ago. But we do have hope now with this administration that we can, provide this model and this toolkit to be able to replicate it.
And I just say in addition to that Navajo Nation is such a particularly interesting model, because it had the leadership from the beginning of President Nez. It had a cultural buy-in. It has a reverence of its elders. And so when we were able to come in as basically a boost organization, we had leadership already present, tribal leadership that gave us the rest of the tools. And so we were really able to see great productivity there.
Well, it goes without saying, Anne and Sean, that you all are just doing extraordinary work out there with CORE. Your crisis response here during the COVID pandemic, but also crises around the world. So thank you both, and thank you for taking the time to be with us.
Thanks for having us.
Thanks, Lisa.
And that was legendary actor Sean Penn and Ann Lee from CORE Response. It is just so inspiring to see how they've taken action during this crisis. But as Ann said, they shouldn't have to be the biggest testing site. There is so much need for testing and the full stream of services, especially now. But again, so inspiring to see organizations like CORE raising their hands to be part of the solution. You are watching The Road to a Vaccine, and we are live. Our next guest is J&J's Chief Scientific Officer, Dr. Paul Stoffels. We know so many of you have questions for him, so please put them in the comment section, and we will get to as many as we can. He rounds out the last episode for our series this year. Dr. Stoffels, welcome. It is so good to see you back for our last episode of the season. Now, we've been following your progress on J&J's vaccine candidate, but can you give us just a snapshot of where you are with it currently?
Well, happy to be back, Lisa. Where we are today is we are in the middle of our phase 3 study. We have more than 20,000 people recruited into the study on a global basis, and we recruit about 1,500 people into the study every day at the moment. So We said we are going to do a study up to 60,000. We are evolving where we are, and very quickly we'll get them recruited. And so hopefully towards beginning next year, towards the end of the year, the study will be fully recruited, and in January expecting data in that time frame.
Now, Dr. Stoffels, we've been hearing a lot about RNA vaccines lately, which are different from J&J's vaccine candidate. Can you explain the difference, and how many different vaccine platforms are there?
Well, first, to answer the question, how many different platforms, there are many different platforms, probably dozens of platforms. There are at least more than 100 vaccines somewhere in the world who are being progressed. But basically, it comes down all the time to how can you get immune response to the spike protein. And the spike protein can be administered as the protein, but also can be administered as a genetic material. And so the mRNA, they contain in their information, the information to create the spike, the protein, the specific protein in the body. So you bring the piece of RNA in a certain formulation in an injection into the body. That's different from a vector. A vector is an other virus, a cold virus, an adenovector, where we put that genetic material, we'll build it into the virus. It's not replicable, but it's a live virus. We inject that, and that elicits a very strong immune response. So it are different ways of bringing a piece of genetic material into the body, which then produces the antigen, which then gets to the response. And it has shown to work very well in the first few vaccines which have come out with data.
Now, we see these numbers published about the efficacy of vaccine candidates. How is that data determined, and how do researchers even measure how effective a vaccine is?
Yeah. A few episodes ago, Lisa, we talked about prevention for transmission, prevention for disease. And so what the data which are reported now are prevention for disease. So half of the people in these studies get a vaccine, half of them get placebo, and then the researchers are going to measure how many people are infected and get sick. And it's the number of people who get sick or very sick, so moderate or severe disease or some kind of disease, compared in the active and the placebo group. And it's measuring the protection against getting the disease. And that are the numbers which are currently reported, and they're very strong. You can prevent very strongly to disease. You can prevent for that. But what we don't know yet is of whether we can prevent for transmission. So that's something we still have to learn in the coming months, of whether the same studies can now show that you also prevent for transmission.
So, Dr. Stoffels, does that mean that if it can prevent the disease, you may still be able to transmit it despite not receiving the disease, not getting the disease?
We don't know that yet, but there is a possibility that it doesn't prevent for transmission, that you still could shed the virus even when you have got a vaccine, don't get sick, but you still can get an asymptomatic infection. I don't say it will be like that, but we don't know. So we have to learn at the moment still. And that's a big complication not big complication, big worry on the vaccine will not protect everybody every time, everywhere, so that we can get rid of all the protection we do today with masks and hand hygiene and keeping distance and all the rules which are in place to prevent the transmission. So we still have to be very careful. While it is a fantastic news that you can prevent people from getting sick and very sick, we don't know yet whether it will limit the spread of the virus from one to another person.
And I know that these are things that are being studied for all of the vaccine candidates out there. Dr. Stoffels, we have a question from Pomita from Facebook who asks, will a person need to undergo an antibody or antibody test before getting a vaccine?
I don't think so. It will depend on the vaccine and in the end what the FDA decides. But if you are positive, then most probably the vaccine will give you a good boost and further protects you. And so it will show in the studies also whether it's safe. So there will be people which have already positive antibodies in the studies, which will be vaccinated, and we'll learn the safety and the efficacy of the vaccine in people already positive with antibodies.
We have a question from Alec from LinkedIn who asks, has J&J included a diverse population of people in its testing protocols to ensure tangible effectiveness?
Well, it's a very important mission to include diverse people, especially the people who are at higher risk, and importantly the elderly. We have seen all that the elderly are at very high risk from getting severe disease, but also certain populations with comorbidities, like the African American, Latino, that are a part of the population who seem to be more vulnerable for the disease. And we have a very diverse population included in the study, in the US, but also on the global basis. So our study is run in 200 centers in the world. We are recruiting in Latin America, South Africa, and in the United States. And that will give us a very diverse population, and we'll learn from that population on the effectiveness, but also the safety.
Will people who have recovered from COVID and have antibodies, will they still have to get a vaccine, or should they get a vaccine?
Well, it's accepted that people will be protected for a certain time when they have, let's say, that when they got through the disease, they will have significant antibodies. We need to learn whether they can get reinfected, and there are some anecdotal information about that. We don't have yet systematic information, but most probably they will need to get a booster after some time in order to up their immunity for the virus.
I have another question from Annette from Facebook who asks, what happens if the vaccine gets above the crucial temperature, and who monitors that? That's a great question.
Well, this process is very well monitored. For vaccines, each of the different shipments are monitored, and when it gets above the vaccine will not, above temperature, that it is unstable, vaccines will not be administered to people. Now, there are certain requirements and certain guidance on that, like our vaccine will be shipped at -22 centers, 2 to 8 Celsius, it's stable for up to 3 months, and then it can stay a certain time in room temperature while being administered. And so typically we limit that to 1 day or a few hours. And so vaccines are quite stable for short period, but the transport is very strictly monitored from the beginning to the end.
Now, we are heading toward the winter months, and experts are warning of a dire increase in cases and deaths due to COVID-19. What do you anticipate in the coming months?
Well, I think I anticipate a significant increase, unfortunately, over the world, in many parts of the world, because of the year-end. The year-end is always a family party, and family events get together. But I can only say, please, try to be very, very careful. Vaccines are now there. There is hope that in the course of next year, we'll get this behind us. And if you want to see your mother or your grandmother after the summer, make sure you protect people before the winter now, and make sure that you adhere to the measures which are asked by your authorities to prevent. We have seen in Europe that as soon as you take significant measures, like in many countries have been done over the last 4 weeks, you see immediately 30 to 50% reduction in cases. So it is very quick that you see the results. So it is effective to take measures, and it's not that bad. We still live. I'm calling you from Europe. We still meet each other through our iPads and to our phones. We try to limit the contacts to 1 or 2, not more than that, and then you can prevent from getting infected. And I would recommend, don't take risk. There is a light at the end of the tunnel, and light at the end of the tunnel for yourself, but also for your family members. Don't take the risk, and take all the measures needed to prevent.
Dr. Stoffels, I know you're a scientist, but I'm wondering if you could take a moment to just speak from the heart. You have seen so many deadly diseases over the years and fought them. I remember you talking to me about what your experience was like when you were in the heart of Africa dealing with HIV and AIDS. So what are your thoughts on where we are right now in this pandemic, and where do you see us going from here?
Yeah. When I was working in HIV, the moment we had the triple combination therapy, and so we could bring the virus to undetectable, we knew that we were going to get to a therapy which was going to make people survive a long time. And we are now at the moment, since a few weeks, that we know we have vaccines which can prevent the transmission, and that we will be able to get this vaccine, this virus behind us. It's a matter of time now. The science starts to emerge that we can get this done. And that's where people have to be a little bit patient, that we can get to the process of getting studies finished, vaccine approved, and then rolled out over all the different countries in the world. But we'll get this behind us. And so it's that moment, this hurrah moment, like, yes, this works. The vaccines, they do it. And you know that we knew already from the animal models, but you're never sure. You have to say, okay, let's now translate that to humans. And the first vaccines now really proved in humans that they work. And so that gives such a hope to the world that we can get this done. There are several companies with the vaccine. There will be hundreds of millions of vaccines being produced at this moment, become available in the next year for almost everyone in the world. I think there will be a vaccine, and that is going to give hope to everyone. But we have to stay very vigilant in the meantime to protect our loved ones and our environments and ourselves from being infected.
This really is such an extraordinary time in science, and come January here in the US, at least, we will have a government that really champions science as well. Dr. Stoffels, thank you for taking the time to be with us. This is the last time we'll be seeing you on this show this year, but we look forward to catching up with you next year with hopefully some very exciting news. Thank you so much.
Thank you, Lisa. We'll be there.
Great. Now, we've had so many world-renowned experts on this show. I thought it would be good to take a look back at some of the most profound statements that have been made over the last 9 months. Let's hear from what we've been told.
This is probably the greatest public health catastrophe that's faced the United States in 100 years. And the tragedy is we can do something about this.
There's something about this disease that is not only different, it is pernicious.
While coronavirus has affected all Americans, it has disproportionately affected Americans from the most vulnerable communities.
It is a successful vaccine or vaccines that will really provide the blanket of protection that we need to make us go back to some kind of new normal again.
Collectively, we can do more than we can do separately. Certainly that has been the case with COVID-19.
You know, the frontline heroes, they're putting their lives on the line for us, and they put themselves under unimaginable amounts of stress, but they're human too. And we need to point out to them that there's nothing wrong with getting help for yourself.
We look for the little pieces of joy, and we share them with each other. And we celebrate every time a patient is discharged alive, and everybody gets excited for the success that we're having in all of this.
It's so important, as much as we all can, students and parents, to be like getting outside, try to be in community with other people in some way that is safe, just to sort of keep us afloat, hang on to those habits.
We should be physically distanced, but socially connected.
Wear your mask in gatherings, but also wash your hands and make sure that you don't have any form of transmission through the winter until we have a vaccine.
When I see a patient who was intubated, now being extubated and no longer needing the ventilator, I know that there is hope. And that's what makes us, go at it every day, wake up in the morning with a strength and a vitality that we can definitely beat this, and we will beat this.
And that is it for this season of The Road to a Vaccine. Working on the show really has just been so incredibly illuminating for me, and I hope it has been for you as well. It has been such an honor to have been able to ask questions of some of the greatest scientists and thought leaders in the world. All of us on this show are so proud to have shone a light on science at a time when we need it the most. The unknowns of this virus and the responses to it have at times been incredibly complex. But if science is our beacon, it will show us a path forward. Although some of our most challenging days of this pandemic may still be ahead of us, I know we will see better days. This year has brought with it so much struggle and loss, yet the human spirit is alive and well in homes, in hospitals, schools, and entire communities. I have been humbled by your stories and those of our guests, and I want to thank everyone who's been part of the show. We have heard the guidelines. We know what we need to do. With science as our guide, we will reach the finish line. With warmth and gratitude, I wish you all a very happy holiday season from our entire team at the Road to a Vaccine. We will see you next year.